Sidney Kgara, who is Nehawu Policy Development Unit Head. Thank you so much for your time this evening. Firstly, your reaction to the signing of the NHI Bill into law tomorrow.
Well, at Nehawu, we've campaigned for the NHI for a long time with a view to ensure that the country achieves universal health coverage. Together with our federation, we are very proud and excited that finally government gets to sign the legislation into law to allow for the creation of national health insurance. And therefore, it is a momentous day for us because now we can start a process towards realization of universal health coverage.
And some have said that this is political desperation, while Business Unity South Africa, for example, says that while it supports universal health coverage, there are concerns that the NHI bill in its current form is unworkable, unaffordable, and is not in line with the Constitution. How do you respond?
Well, the NHI has been endorsed by a majority of South Africans in 3 consecutive elections since 2009. It can't be political expediency or opportunism. At the same time, you cannot deliver universal health coverage without pooling all resources into one pot in order to ensure cross-subsidization. So far, they have not provided an alternative methodology of achieving universal health coverage. They want to maintain the current for-profit maximization health system, which is divided between the rich and the poor as a relic of the apartheid system. So we reject that.
And of course, funding still continues to be another sticking point, especially when you look at the fact that, some say that there's a lack of detail and clarity around funding. And, I wonder and what impact this could have on taxpayers. How concerned about, for you as Nehawu, how concerned are you about this particular issue of a lack of clarity around the funding and how everything is going to work?
Well, we already know what sources of funding for the NHI are going to be. They're outlined in the white paper, they're outlined in the legislation. But of course, the advisory committees that will be established in terms of this legislation will work out the details of that. And actually, we expect that over time, the health spending in the country is going to be reduced. As currently, South Africa is spending way over the recommended 5% of GDP by the WHO. We are now approaching 9%, which really shows that we are not getting value for the money that is being spent, especially in the private sector, as exposed by the Competition Commission inquiry that showed that the members of medical aid schemes are not getting value for money.
But when you talk about the issues around the white paper, for example, one could argue and say that we're still dealing with estimates. We're not dealing with the exact costs and how things are going to work. And that's where some are raising the concern to say that if you're still dealing with estimates, how then are you moving ahead?
Yeah, that's exactly what the WHO is advising, that you cannot have a definite amount that would be spent on the NHI before you start implementing. But we also think that there will be some efficiencies that are going to be created through the reorganization of the health system, including the payment mechanism that will start reducing the costs, as well as the emphasis on primary health care as part of creating referral pathways that will limit the unnecessary utilization in the tertiary level or at the secondary level.
According to Nehawu, do you think the healthcare system has the infrastructure to be able to handle the implementation of the NHI?
Well, every country that has implemented universal health coverage, it understood from the beginning, this is a progressive way towards achieving your goals. You don't start already having everything. Otherwise, why do you need the national health insurance when you already have a properly functioning health system and so on? So over time, as the resources are starting to be distributed properly in the country, not only for a minority in terms of the members of medical scheme, it will then be possible, who are, by the way, highly subsidized by the public sector, progressively will be able to achieve the minimum standard that will be required in terms of accreditation for the national health insurance.
And what about the resources available in terms of personnel?
The health care workforce. Yes, that will allow. Currently, we also have an unhealthy competition that is there, where the private sector has to pay more in terms of its workforce in order to entice the workforce, the healthcare workforce, into its realm. And at the same time, government is unable to match that. So there will be a move towards a more universal standards in terms of conditions of work for workers. But of course, the majority of the clinical workers are in the private sector. And now they'll be able to work as well in the public sector in a way that will address the needs of the country. Obviously, it will be under different conditions as opposed to the current for-profit context of the private health industry.
There are threats, though, to take this matter to the courts. Do you think it can stand legal scrutiny?
It will be interesting what the argument would be, because access to healthcare is a right in South Africa. It's supposed to be an obligation over the state to ensure everyone has access. And when the government will be acting in favor of or implementing that obligation, what will be the basis of insisting that the healthcare must actually be a commodity, as the private health industry is arguing? So we don't think that the Constitutional Court will favor that argument, because it's supposed to uphold the Constitution as a court itself.
All right, let's see then what happens. Thank you so much for your time this evening. That was Sidney Kgara, Nehawu Policy Development Unit Head.